For this skill, you will need several items. In the medical record, you will need the order for the transfusion, the verification of labs and blood typing in the labs section, proof of informed consent. Items you will need are the patient's ID band, the patient's blood armband, which is usually red, and the unit of blood product. In EHR Tutor, you will begin by verifying your patient's name and date of birth and medical record number. Once you scan the patient's armband, you'll notice that you are taken directly to the MAR. This is not the area that we want to be in. Click on the Orders tab and verify that you have an appropriate order, and under More Details, see if there's any additional information. You may then check the Labs tab for labs indicating the need for the transfusion, as well as the patient's ABO-RH blood typing. Because EHR Tutor does not have a place for only documents, we will use the Imaging and Results tab for our informed consent or any other documents that you may need to access during your patient's care. You can click on the item to maximize it, and you're going to make sure that you have the appropriate name, date of birth, and medical record number, and that the form is signed by the patient or a healthcare proxy or power of attorney. You can just click on the screen and it will take you back out of the form. Under your flow sheets, you will find your Blood Administration tab. This is where we're going to document our transfusion. You can see here that I've already entered my pre-transfusion vital signs that I have done directly before my transfusion. In order to enter a new flow sheet, we're going to click New Entry. At this point, it is time for the manual verification of blood products. We need 2 licensed nurses, with the primary nurse being at least an RN. The patient's name, date of birth, and medical record number, which can be found on the patient's armband, the blood band, the label on the blood product, the medical record, and the blood product informed consent. The patient's blood band number can be found on the patient's blood armband on the label of the product if there is a secondary label. The patient's blood type can be found in the lab results. The unit's blood type will be displayed on the unit. The blood donor number will also be displayed on the unit. Watch here as a verification of a transfusion is performed. Okay, today we have Carl Shapiro. Date of birth is July 19th. Medical record number PCS 71900. Patient type O negative. Unit type O negative. Unit number 2121515. Once all manual verifications are done, now we can fill out our flow sheet. Select the appropriate answers to all the drop-down boxes, and on the blank boxes you will click inside them and then scan the appropriate barcodes. The donor ID again can be found on the blood product label as well as the blood product type. For the patient's blood type, you will manually type that in. The amount to be infused can be found on the patient's label that is placed on the unit of blood as it is being assigned. This is an estimated volume, but you may put that number inside this blank. You will also fill out the total of units that are ordered for this patient. You will then type in your credentials, including your first and last name and title, with the first verifying clinician being at least a registered nurse, and the second verifying clinician will be at least a practical nurse. Since I recorded these vitals prior to entering the flow sheet a second time, I have my appropriate baseline vitals. You will then select the date and time that the transfusion has been started. The other information below this cannot be filled out until we enter a flow sheet after the transfusion. Now you can see that all the data that we entered is on our flow sheet. Make sure that all of this is correct, and if not, go back and edit it as needed. Your patient must have at least a 20 gauge IV access. Once blood is verified, you must appropriately flush the patient's IV access. Verify blood return and then flush accordingly. In this case, we are using a Y-type blood administration setup, and always make sure that blood tubing has an inline filter. And aseptically remove the stopper from the normal saline bag. Uncover one spike and spike the saline bag, allowing the fluid to prime through the filter and the rest of the tubing. Some tubings will have a drip chamber just above or below the filter. Make sure that is at least half full as well. Prime the saline through all the way to the end of the IV tubing and place near your patient. Then you may remove the spike from the other end of the Y-type tubing and spike one of the ports on your bag of blood. Close off the saline and then squeeze your filter chamber to pull blood down from the blood bag. Notice the blood moves slowly to the patient. Your blood transfusion does not begin until the blood actually begins infusing through the patient's IV line into their vein. Another way that we can administer blood is with regular primary tubing and an ad hoc inline blood filter that can be added to the line. To use this, no saline is required. Open up your IV tubing and inspect as usual, and then open up your ad hoc bloodline filter. The filter itself will have a spike on it that you will actually use to spike the blood bag, and it will have a female adapter end that the IV tubing spike will go into as well. This turns it into blood tubing. Remove the female adapter port and remove the spike from your line and spike into the bottom of the blood filter. Make sure the connection is secure. You may then remove the spike from your filter and utilize it to access one of the ports on your blood bag. Then squeeze the filter chamber and then the drip chamber of your primary IV bag and proceed as usual. Prime the entire set with the blood all the way to the end prior to connecting to your patient. With this type of transfusion setup, it is important to have a small bag of normal saline available for when the transfusion has ended, so we can continue to flush the line through with saline so the patient receives every bit of the blood transfusion. As a registered nurse, you must stay with the patient for 15 to 30 minutes, reassess vital signs prior to leaving, and monitor for transfusion reaction.